Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-year cancer survivor, available on Amazon. In this video, I'm going to answer some questions. Questions that have been sent to me, questions that came across my feed. I'm going to do it in rapid fire so that I can get to as many as I can. I do need to preface this that I'm not a doctor, so you are not going to get medical advice from me. You're not going to be told what you should do. But I'm going to give you information. I'm going to give you personal experience as far as things and how I dealt with them. And the first question actually pertains to drinking alcohol, which covers both areas that I'm somewhat of an expert in, cancer and cardiac. So as far as cancer goes, again, drinking alcohol, if you really have to, I would throw that by your oncologist. They know the drugs that you're being given for your treatments, and or your radiation therapy. They know better as far as any impact that alcohol, which is considered a depressant, could drive down your immune system more than what it already is. A little side note, if you're dealing with Hodgkin's lymphoma, alcohol is also known to cause pain. Don't know why, but it's a common symptom among Hodgkin's patients. As far as cardiac goes, again, if you're taking blood pressure medicine or other medicines to control your heart rate and stuff, you might want to ask your doctor about alcohol and how much you can drink if you can drink. Next, dental. Okay, dental, again, as far as the world of cancer, if you're going to need any dental work, they usually recommend that you get it done before you start your treatments, only because of the risk of infections. And once you start going through treatments, your white cells do come down. You become more susceptible to things. As far as cardiac goes, my dentist once told me that it's often through the dentist that some patients actually find out they have heart problems. Okay, if you're like me and you have heart problems because of your treatments, okay, once you start going down that path, it's really strongly recommended to take prophylactic antibiotics. You call up your doctor, they give you a round of antibiotics to take, usually about an hour before your dentist appointment, and you should, in theory, be good to go. And it could be as simple as going for a dental cleaning, or it could be something more involved like a root canal. But any risk that you have of bacteria breaking loose and getting into your bloodstream, which causes some really bad things such as sepsis, look it up. You don't want that. So if you can have an antibiotic in your system before you have that dental procedure, your dentist is probably going to require that anyway, as well as any kind of clearance from your cardiologist. Red Devil side effects. Okay, I'm going to try and be brief with this because I want to get to these other questions. Red Devil, adriamycin or doxorubicin. Okay, we call it the Red Devil for a reason. It is a nasty, nasty drug that's really successful in treating cancers, especially Hodgkin's lymphoma and breast cancer. Okay, now there are immediate side effects such as mouth sores, nausea, things like that. But also cardiac issues. Okay, the Red Devil, and I'm going to say that as opposed to saying adriamycin and doxorubicin every time, is known to beat up on the heart muscle really bad. So if you start feeling like short of breath, if you're developing a cough, things like that, you need to let your oncologist know right away so that a heart study can be ordered, if necessary, a lung study, but to make sure that you're not having any serious side effects from the Red Devil. Long term, it could have implications. That's why you'll hear me repeatedly in my videos saying to make sure that you get heart studies done every so often through your primary care physician after you're discharged from your oncologist. Driving after open heart surgery. Okay, that's a big one. Everybody wants to get back to normal. And there's any number of reasons why you're usually told to wait at least 8 weeks before you get behind the wheel. Of course, your breastbone is open up, your chest muscles. You use these when you steer your car. You need to be able to move your upper body to look, to turn, whether you're parking, all these things. You need to be able to do it without the distraction of pain. Okay? Now, there's also another issue mentally because there are some who develop cognitive issues following their open heart surgery because a lot of people are put on what's called a heart lung machine. We call it pump head syndrome. Get a little forgetful. Sometimes our reactions, our reflexes aren't what they used to be. Okay? You want to make sure that you are fully recovered from that before you get behind a wheel. Okay? You need to make sure that you're able to focus behind the wheel. And physically, yes, you need to be sure that you can turn that steering wheel pushing this pain. Okay? It's not pleasant. You're still going to have that pain, going on to 8 weeks. But it's a lot better than if you try it after I've seen some do it much sooner. Don't recommend that. Sleeping positions with open heart surgery, you go in for open heart surgery and all of a sudden you're stuck on your back. And if you weren't a back sleeper, it takes a long time to get used to it. So when can you resume back to the way you used to sleep? I was a big left side sleeper. One thing my doctors didn't tell me was that after doing my open heart surgery, if I rolled over on my left side, which I did after about 2 weeks, my heart shifted. And it shifted in a way that it pressed up against my rib cage that I felt my heart pounding on my rib cage. I actually thought I was having a heart attack the first time that happened. And then because now I do have social media, I had others telling me, yeah, this is what happened. I have that issue too. If I roll over on my right side, I don't have that problem. But on my left side, it does. So really, it's a comfort thing. When you get home after open heart surgery, it's really just a matter of adjusting little by little. I didn't just roll completely over on my left side. I little by little just adjusted as the days went on. Pain after open heart surgery. Look, that's probably the biggest part of preparing yourself for open heart surgery is after. Okay, and there's this big stigma about asking for pain medications. Okay, don't be a hero. If you're in pain, say something. Stay on it, stay ahead of it, because that's part of your recovery. And if you're dealing with the stress of being in so much pain and you wait till last minute, that the lesser drugs won't even touch it anymore, and you're going to end up having to use the harder stuff anyway. Okay? You go on it for a few days, and they eventually step you down, and if your pain tolerance increases, then you can go on less. But if you need to stay on it longer, so what? Don't be a hero. Okay? And then finally, rehab for cardiac or cancer. Cancer rehab, real simple. For however long you're doing, whether it's 6 months, whether it's a year, 2 years, or whatever, there's that desire to get back into shape. Okay? There are cancer rehab programs available. I encourage you to participate in those. Cardiac rehab, look, you could have belonged to a gym, you could have been Mr. Olympia, okay? And you may say, I don't need cardiac rehab. Yeah, you do. And here's why. Cardiac rehab, you get hooked up to a telemetry unit, which goes to a nurse's station, who, while you're exercising with your new repaired heart, your nurse is watching to make sure your heart doesn't do anything wonky. Because if it does, they need to stop you. And you can't do that on your own in a gym. So that's my recommendation. Make sure you do your cardiac rehab if you're offered it after open heart surgery. 6 questions, I got them all in. Until next time, this is Paul's Heart.